Sure. This year, I'll be presenting alongside Jigger Thacker. He's the Chief Administrative Officer from OU Health in Oklahoma. And so together, we'll be talking about the benefits of specialty pharmacy for patients, specifically those of health safety net hospitals like OU Health in Oklahoma. Um, More specifically, we'll be talking about how OU Health was in a really tough spot financially, how they worked with Clearway Health Services to help build a specialty pharmacy program, alleviate some financial burden, and really improve their service lines in both pharmacy and other services that we provide to them. And where we basically focus on building up a program and um, focusing on patient and medication adherence and outcomes. I think it's really how specialty pharmacies can help alleviate challenges that every hospital or health system face. Really, it can really address problems like patient consumerism, staffing shortages, financial performance. It really uh, is it can solve for problems that are far outside the mold of what is really innately obvious to a health system. How it can create a really patient centered experience, and I think that for those that will be attending, they come from a very wide variety of backgrounds. I think telling the story about how improving access really helps patients kind of get more engaged with their therapy. How creating a concierge like program can and increasing that level of communication and interaction with the patient really leads to better outcomes. And lastly, I think it's really how complex the entire aspect of specialty pharmacy is, especially in the health system. We have come from a very varied amount of backgrounds, and how do we build sustainable programs within the health system. Myself, I am also from background in the health system, and how do we identify areas that we would focus on first? How do we define and measure success? And how do we really get the entire health system around this type of program, giving all the other competing priorities it may have? I think I would bucket into three different items. One is definitely patient experience, where health systems focus the most is like what kind of engagement are we getting out of the program? And I think consistently you always see, for at least at OU Health, there was no measure in the initial part for specialty pharmacy, and as we built this program, we measured that there was over a 90% or 92% net promoter score for the program. I think secondly, on average, specialty pharmacy medications in the unmanaged space can have an adherence rate of anywhere from 60 to 80%, depending on the level of engagement of the patient. But the big thing at OU Health is that we were able to obtain an engagement level of over 95% or adherence level of over 95% on medications for those patients. That means that 95% of the time the patient is taking the medication as expected and as intended. And I think the outcome there is that, it not only creates a better clinical picture for the patient in the future, it also creates an environment where we understand what's actually going on throughout therapy. A lot of times when we don't see that, you don't necessarily see that unless you have a deeply integrated program that communicates pretty closely with the patient. So those are some examples of ways that we've kind of enhanced or measured the program. I think bringing to light the level of work that's necessary to kind of generate these services in house at a health system is really what we're trying to showcase. It can have really big benefits not only for health systems, for patients, providers, and actually for the intended outcomes of the specialty medications. So for people who make these drugs, hearing about how we're helping guide the patient through the journey of their treatment is critical. 80% of the drugs in the pipeline for 2023 are specialty meds. So this is only going to be an increasing priority for health systems as they start to treat their patients. It's really mission critical for hospitals to develop both the processes and the processes and the programs to kind of develop and help guide their patients as they're on these specialty drugs. Anything that we can do to either alleviate the process or make it more streamlined so that care teams who are taking care of patients don't have to worry about things like prior auths or like insurer barriers or access to the drug really helps benefit the whole care continuum all the way from those who develop the drug all the way to those who take the drug. So I think those are the key points. I think a lot of health systems do this level of work or try to. There are a lot of access issues that present themselves to health systems nowadays, whether it be through access on savings for drugs or the ability to obtain them. I think it's important for those in the market to hear the story of health systems, how beneficial it can be to have a local system, a program, and have that access available to their patients today. So I think hearing the perspectives of those who take care of patients and those that have immediate care responsibility for those patients is going to be really vital for those who control either the access chain or the ability to obtain drugs. So